number of publications. Normally, the deans or the principals or the vice chancellor sitting will not be very strong in the research, but he is an exception. He has got certain patents also in his credit, and he has got wonderful publications to his credit. So he's a fine. We are fortunate to have a fine blend of an administrator, an academician, and a researcher. So I don't know. All these things are taking the university and the constituent of colleges of great height, I'm sure, in the days to come. This is sir's one brief idea. After that, I think we can discuss and take our understanding and collaboration forward, Michael. And for the listeners and the delegates from what do you call schools and colleges in India and abroad, it is my pleasure to introduce Michael Kurtz. Michael Kurtz is, I'm also meeting him for the first time, but I had the privilege of talking to him for 15 minutes before they started. I just logged in at 15 and he was, as usual, very prompt. And Professor Michael Kurtz is the professor of Department of Pharmacy Practice and Science. And he's also the director of College of Pharmacy International Programs and director of College of Pharmacy Residency Programs in the University of Arizona in Tucson in Arizona. A nice part to be there, and I think it will be very hot during the summer and very cold during winter, and maybe one of these days we can visit your place. And he is practicing in the medical center of Tucson, and also his area of interest is, I see that general internal medicine, endocrinology, HIV/AIDS, infectious diseases, and evidence-based practice. Michael, I see that you have got widespread this one. No, and also he teaches pharmacy students in both the classrooms and experiential learning, what I have seen. So basically, we can call him as a pharmacist and our professional. And he was selected in 2001 by the Arizona Health Science Center as Dean Teaching Scholar and has received numerous teaching awards. And also, he is the past chair of American Society of Health System Pharmacists Commission and Therapeutics. He has got several publications. In fact, I was going through his other publications. It ran into, Michael, 24 or 25 pages. Obviously, you can't expect me to recite that, but one word is enough. He has got wonderful, many publications, and also one of the most important books, which is known as Principles and Practices Study Guide, a case-based care plan approach. It is in 6th edition now. And also he is involved in international education. This is very evident because you are very present in India right now. Of course, it is in virtual. Shows that you are involved in the international education and practice for 20 years, and you are serving as many college director in international programs. And you have received the University of Arizona's prestigious Excellence in International Education Award, and also consulted and lectured extensively in Asia. Michael, I think you have visited Japan several times. I was just going through your CV, and you have got interaction with several universities in Japan. So is in some of the universities in Thailand. What was interesting for me to see that you have developed a collaboration with Thailand, and you are also looking for developing some sort of consortium with other developing countries, similar to what you are having with the US-Thai collaboration. So possibly, I think you can make it the US-India or US NGSMIPS collaboration sort of thing. Arizona University and Uday and his team can take the things forward. And since 2009, you have been associated with the Saudi Arabia in training the clinical pharmacy faculty members and practicing hospital pharmacy in a large way. Of course, I think practically you have visited every country. Many publications are there, and you are a globetrotter. That is what I could make it out. But right now, we are all the delegates who have registered will be eagerly looking forward to understand what the role our pharmacists can play in these challenging times. And of course, Uday must have briefed you while talking before that. The students are also involved in some of the COVID monitoring system and all those things. With these few words, I very warmly welcome you, Michael, to Nitte University and also NGSM Institute for Pharmaceutical Science, and with the hope and vision that this will not be one time talking to each other. It will continue. Possibly Uday will visit your place, and possibly you will come here. Corona permits. I am looking for meeting you in person rather than in virtual. And I also take this privilege to welcome all the delegates all over the country. including Nepal and UK, as Uday puts it. It's a great occasion for them to interact, and after the talk, I'm sure that he has put some time to interact and discuss. May be possible. And also, I see the vice principal of the college, Professor Narayana Chalu's face there in the screen, and I welcome all other people who are there. So, yeah, I have spent my 5 minutes of time. Welcome you all. Thank you very much for being here, and we will take the things forward. Over to Uday. Uday, please take the things forward.
Yeah, thank you very much, sir, for welcoming the gathering. So now it's a time for our Honorable Vice Chancellor, Professor Dr. Satish Kumar Bandari, has always been a strong pillar of supporting all our endeavors. Sir, now I request you to kindly deliver the opening remarks. Over to you, sir.
Very good morning to all my delegates from India, and good afternoon to our very distinguished speaker, Dr. Michael, Professor of Pharmacy from College of Pharmacy, Arizona, and all my colleagues from Nitte Dept University, and participants in this very unique program conducted by our pharmacy school regarding the role of pharmacists in vaccination program. During this very difficult time, this is very apt. I congratulate the convener of this program, Professor Shastri, the principal of the Pharmacy College, and Dr. Uday, who is organizing this program. Congratulations, and also congratulate my colleagues from the Pharmacy School. As you all know, we are going through a very unprecedented situation, and the mystery behind this SARS-CoV-2, popularly called COVID-19, is very mysterious, and we know that it has caused unprecedented economic and lot of setback to the growth of the whole world. As you all know, the virus has created a lot of uncertainty and a lot of misconceptions among the people. The number of people affected is huge, and when we are talking about India, we are a large nation. We're most population, second most populous nation in the world, and we should think in terms of the number of people living in this country. 16% of the world population is living in this 4% landmass. So we can imagine the amount of pressure on the administrators and health care workers, doctors, nurses, and allied health courses, and even pharmacists that are facing in the country. Corona is not new. They're known for many decades. SARS-CoV-19 has created a mysterious, in the sense of from this origin, the way the epidemiology, the pathophysiology, the treatment, and outcome of the disease, totally it is uncertain. Being a viral disease, now we understood that no specific treatment for this condition. Whatever we do is a prevention. Prevention is by following healthcare etiquette. COVID behavior is very important. And now, fortunately, we are grateful to our scientists that we have got the vaccination. So vaccinating this country, whole country, with the 1.4 billion population, I think the deserving candidates are around 80 crore plus population should be vaccinated, and it is a huge task. I was going through the statistics of the patients who have received vaccination. Recently, in June 1st, we started the third phase of vaccination. I'm very happy to tell you that already India has vaccinated 30.72 crores of people. And in the last 4 days of the third phase of the vaccination, I'm very glad to note that 2.7 crores of people have been vaccinated. This tremendous work is going on in this country. And with one of the particular day, we reached 90 lakh people got vaccinated. This is really commendable work done by the government. I'm very happy that things are moving in a very prospective, very happy manner. And when, as I think I heard Shastri discussing with you about our university. Our university is just a 12-year-old university. Our flagship one of the institutes of the university is our 1,000-bed hospital. This hospital is a designated COVID hospital. I'm very happy to tell you that first patient of this region was treated in this hospital during the first wave. And I was going through the statistics. The number of patients treated in the intensive care unit is around 2,000 patients. And our mortality rate is around in the range of those who have gone for ventilators, it's around 10 to 12%. It is acceptable compared to the international standard. So we started with the COVID diagnostic lab, plasma therapy unit, and recently we have started vaccination drive from the university. I'm very happy to tell you that around 97% of the faculty and students of the university have been vaccinated. And taking it to the community, already started the vaccination drive, and around 40,000 people in and around this city have been vaccinated. And we took the vaccine to the doors so that the people, particularly the elderly people, disabled and marginalized people can get the vaccination. I'm very happy that this university has contributed the this corona pandemic period by very actively involving our faculty, particularly the doctors, nurses, physiotherapists, pharmacists, and even dental surgeons have contributed in helping the government, in supporting the government in this unprecedented situation. Regarding the topic for this day, I am very happy to tell you that our pharmacy college very active in supporting the hospital. They have started a PharmD course, 6 years PharmD course, in line with what US or other developed countries follow. I am very happy to tell you that they are supporting the hospital, they are posted in the hospital and supporting the clinicians in dispensing the drugs, educating the people about the side effects of the drugs, and reporting untoward side effects of the drugs, and in a lot of activities. Unfortunately, in vaccination, I think because of the government guidelines, we could not employ them in vaccination process, because in the country, this is being considered, because as Uday said, we have got a very huge force of pharmacists in the country, with more than 8 lakhs pharmacists with outlets in the country. I think this particular section of the healthcare sector can be used for effectively for vaccination drive. I understand that in US already they have laid guidelines regarding getting vaccination, COVID vaccination in the pharmaceutical outlets, and even in NHS in UK also they are using pharmacists in vaccination drive. For the last more than 10 years it is going on, and it's very successful. I request our government authorities also look into this aspect, and definitely we will be in the forefront of educating or training our pharmacists, not only from our institution, other colleges in and around in our university, and getting them involved in vaccination drive, which is, as you know, is a very huge task of vaccinating more than 80 crores people by this year end. I hope this your talk will be very interesting, enlightening, and definitely will take some cues from your talk, and will talk to the administration and authorities here, and if possible, I think we can use our colleagues from the pharmacy college in this vaccination drive. But they have done a wonderful job in educating the people, in creating awareness about the vaccination, because initially there was hesitancy among the people getting vaccinated. And I'm very happy to tell you that our colleagues from the our pharmacy college, particularly PharmD students, got involved in creating awareness about the importance of vaccination. That really helped in removing that hesitancy, whatever the people had about the vaccination. So thank you very much, Dr. Michael, for accepting our invitation to participate in this international webinar on the role of pharmacists in vaccination program. Thank you very much. I'll be happy to, I would have been participating in this webinar. Unfortunately, we have got a academic council meeting at 9:45 to 10. It will be starting at 10 o'clock. Kindly excuse me, and we'll be meeting sometime. As Shastri said, when the things improve, when the corona recedes, we should visit our campus, and we'll be having a very fruitful deliberation discussion, and we'll take it forward to that level of memorandum of understanding between the two universities. Thank you very much. Wish you all the best. Thank all the participants. Once again, I thank our institute, Pharmaceutical Institute, for conducting this program. May God bless you. Stay safe. Stay healthy. Thank you very much.
Thank you, sir, for your very enlightening and thought-provoking remarks. So now it's a time. Professor Michael D. Kos, we are very much delighted to have you here and want to hear from you on the very important topic on the pharmacist's role in vaccination. Over to you, Michael.
Thank you, Dr. Uday. Thank you so much. And Honorable Vice Chancellor Dean Shastri, thank you so much for your introduction and for the very kind invitation. It's really an honor and a pleasure for me to be with you today. And I too wish I was there in India with you. And I hope sometime in the future, when things are less crazy, we can meet in person. Of course, you're always welcome to come to Arizona. It's a little bit hot this time of year, so maybe summertime's not a good time to visit, but you're always most welcome. So again, thank you for the kind invitation. For all the students and faculty who are with us today, thank you so much for joining us. I know it's Saturday morning, and at least in America, Saturday mornings, for some people is more of a time of rest than a time to listen to a presentation. So again, I appreciate all of you attending today. As you know, I'm going to talk about the pharmacist role in vaccination, and my presentation is really going to have, I guess, two different sections. The first section, I'll be talking a little more in general about pharmacist roles, and much of what I'll be presenting is actually from FIP, which is the International Pharmaceutical Federation, and FIP is doing a lot of work around the world in promoting pharmacist role in vaccination. The second part will be talking a little bit more about my own experiences, my very recent experiences, including as of maybe 2 or 3 hours ago, in actually administering COVID vaccine and working in a mass vaccination clinic. So again, there'll be 2 parts. Anytime anybody has any questions, I have the chat box open, so I can see any messages you put there, and I hope we'll have time at the end for some discussion and time for questions. So let's get to it. Well, first, if you're wondering where is Arizona, of course it's in the United States, but Arizona is in the southwestern part of the US. So here's California, where my pointer is. And the red is Arizona, so the southwestern part of the US, and just south of Arizona is actually Mexico. So it's not the United States. So we are in a desert area. It's a little bit hot and a little bit dry. I'm currently in Tucson, which is in the southern part of the state, where the main part of the university is, and the capital of Arizona is here in Phoenix. Probably the most famous thing about Arizona from a tourist standpoint is the Grand Canyon. I'm sure many of you have heard of the Grand Canyon. If you ever visit Arizona, that's one of the places you really have to visit. So again, I hope we can welcome all of you to Arizona someday. Well, the Vice Chancellor and Dean Shastri talked, of course, about the COVID pandemic, and everybody's aware of what's happening with COVID-19. Of course, you're very aware of what's happening in India, but I think we're all aware of what's happening in different countries and all over the world. The numbers you see on the screen are as of 2 days ago. Of course, I'm focusing on India, of course, but also the United States for comparison. And as you can see, the pattern of new cases in the US here, it was very, very different than what you're seeing in India. In the US, we've had sort of 3 different waves or surges. And again, everybody in the world is very aware of what's been happening in India the last couple of months. And, we're all very happy to hear that the number of cases and the number of new cases is going down the graph on the right, the green line, is the number of doses of vaccine that have been administered. And again, the United States, we've administered about 320 million doses of vaccine, and about 50% of our adult population is now fully vaccinated. India, of course, is not quite there yet, and at least the numbers I saw a couple of days ago, about 4% of your population is fully vaccinated. So certainly many people need to be vaccinated in all over the world, and certainly including in India. We've learned a lot about COVID-19. We've learned a lot about the pandemic, and we do have some pharmacologic treatment. Of course, we have non-pharmacologic treatment such as mechanical ventilation. But the reality is, the only way we're going to get past this pandemic is vaccination. There's really no other logical way we're going to do that. And we're seeing tremendous success in countries that have high vaccination rates, starting the U.S. now, Israel, some other countries with high vaccination rates. The number of new COVID-19 cases has dropped very, very dramatically. So the challenge, of course, for India, given you have a population of about 1.4 billion people, is how can you vaccinate that number of people quickly? Because what we want to do, of course, is not only minimize morbidity, people getting sick, we of course want to prevent mortality or deaths, but we also want to reduce the development and spread of vaccine-resistant variants, such as the Delta variant that you see in India. We now see here in the U.S. So the faster we get people vaccinated, the faster we reduce the number of cases, the less of these mutations are going to occur. So again, the question is, how can we do this quickly? Well, there's many ways, and we'll talk about some of those ways in a second, but I think my major point today is that pharmacists not only can have many important roles, but must have many important roles in vaccination. I mean, if we're going to accept the challenge, or if you're going to accept the challenge in India of vaccinating 1.4 billion people, it's going to take every health professional, many volunteers to step up and accept the responsibility, accept the challenge to vaccinate. So it can't just be nurses or physicians or small numbers of different professions. It has to be everybody. And pharmacists, as we all know, have very unique knowledge, very unique skills, and we can be part of the solution to help get us past this pandemic. So again, probably my number one point today is that pharmacists must have many important roles in vaccination. This is a list, and again, this comes from FIP, the International Federation of Pharmacists. And if any of you are not familiar with FIP, much of their material on their website is freely accessible. This is from a document they produced just earlier in 2020, talking about, as you can see, expanding immunization coverage through pharmacists. And this is a list of what they think are the roles for community pharmacists, so pharmacists working out in the community. And while, for instance, my main role for the past 6 months has been administration of vaccine, as you can see, there's many different roles in community pharmacy that pharmacists can play. Certainly advocating for vaccination, and we know this is a big problem with COVID-19, where many people are hesitant or skeptical about the vaccine. The supply chain, when we think about the pharmaceutical supply chain, nobody is better than pharmacists in managing that. So pharmacists play a very important role in managing the vaccine supply chain. Of course, patient education and counseling, dispensing of vaccines, deciding which vaccine is appropriate based on the indication or what's most appropriate for an individual patient. In the US, pharmacists are very actively involved with administering vaccines, both in community pharmacies and in other areas. And of course, part of that is also record keeping, making sure we have the documentation, often required by by various government agencies. So as you can see, this is a short list, but there are many and very important roles that pharmacists can and should play, especially those in the community. Well, why is it important for us as pharmacists to be involved? Well, And unfortunately, we don't have time for all of you to answer that question. But I think all of you recognize that, particularly in a pandemic or a public health crisis, we have to be part of that solution. And the faster we vaccinate our population, the faster we vaccinate our citizens, the faster we're going to get back to our normal lives and get past this pandemic. So again, as health professionals, we as pharmacists have to step forward. We have to get involved in any way that we possibly can to help the people of our countries. It's really as simple as that. So I mentioned the United States, many pharmacists are involved with vaccination. Well, the US is not the only country where pharmacists are directly involved with administering vaccines. And you can see this map. This was published in 2020. The countries that are colored are countries where pharmacists play some role in administering vaccinations. Of course, India is not yet colored, but hopefully that will change in the future. But again, if you think this is only a United States phenomenon where pharmacists are administering vaccine, it's not. As you can see, many countries have that involvement, and that number is certainly increasing. Well, to be involved with vaccination, of course, requires training. And it's crucial. It's very, very important that any role that pharmacists have, not just administration of vaccine, but any role that we have as pharmacists with vaccinations requires training, whether it's training those of you who are students while you're still in pharmacy school, or for pharmacists who have graduated to make sure they're getting the proper training after graduation. And you can see, looking at the countries where vaccination administration is done by pharmacists, much of the training is actually done postgraduate, so after people graduate from pharmacy school, but an increasing amount of training is done with pharmacy students while they're still pharmacy students. Now, there's not much that's good about the COVID-19 pandemic. I mean, obviously, it's been tragic and many people have died. Many people have suffered. But it is an opportunity for us as pharmacists. And particularly when we look at how can we help solve this public health crisis, we can expand our scope of practice. There's more things we can do as pharmacists, more things that we're trained to do than in some countries that we're allowed to do. And again, administering vaccine is a good example. Many countries, including India, pharmacists are not allowed to do that. Well, that's a barrier to vaccinating our entire population. So one saying we have in the US, and maybe you have a similar saying in India, never let a good crisis go to waste. So take advantage of a crisis, take advantage of a public health emergency, and let's use that to show others what we as pharmacists can do, to show that we can help solve this problem. So again, I urge you in India to take advantage of this, even though it's a horrible thing, but take advantage of this public health crisis to expand the role of pharmacists so that you as pharmacists can help solve this pandemic. Now, there's many countries, of course, where pharmacists aren't involved directly with administering vaccine. And of course, there's many reasons for that. And the survey talks about some of those reasons. Some of them, as you can see, are actually lack of confidence by pharmacists. But in many countries, the barriers tend to be governmental or legal. Many countries simply legally do not allow pharmacists to administer vaccines. So that's a pretty big barrier. And that's a barrier that we have to break through in many countries. And I'm not entirely sure what the limitations are as far as legal limitations in your country, but often this is a problem that has to be solved at the ministry level or even higher levels. And you can see in the survey, about 65 or 70% of the respondents said that governmental agencies or other health professionals were actually barriers. So that's something to look at in your country. Now, FIP has produced many documents about this. And again, if you're interested in helping expand the role of pharmacists in India, I would direct you to the situational analysis tool. This is basically a document that's been developed for countries to really assess what needs to be done to expand the role of pharmacists for vaccination. Again, we don't have time today to go through this document. You see the link here on the top of the slide, but I definitely encourage you to take a look at that, and hopefully not only your school, but other schools can collaborate, perhaps with national organizations, to really look at this, and again, help expand the role of pharmacists in administering vaccinations. Again, I know there's a lot in this slide, and it's probably a little bit difficult to read, but this just shows you some of the details, looking at various opportunities we have both at the governmental level with pharmacists, other health professionals, and with the public, but also what some of those barriers are, and then the strategies that can be used to get past those barriers. So again, we don't have time to talk about all these details, but I would urge you to take a look at that document, and hopefully that can provide you with some good information, and hopefully some good strategies. Excuse me. So I've mentioned a couple of times that in the United States, pharmacists are very actively involved with vaccination, and this is a relatively new thing. 20 years ago, this was not so common, so it is relatively new. But in all 50 states in the US, pharmacists are allowed to vaccinate. As you probably know, the United States is like 50 different countries, and every state has different rules and different ways of doing things. So every state has a slightly different way of pharmacists being involved, and this is actually controlled by state boards of pharmacy. This has become so popular that actually, if we look at the adult population in the United States, the majority of adults now receive their vaccines in pharmacies administered by pharmacists. Whether it's influenza vaccine, pneumococcal vaccine, it's pharmacists who are administering that the majority of the time. Now, all the states, all 50 states, require that pharmacists have formal training before they're allowed to administer vaccines. Now, as you can see, it not only includes pharmacists, but this includes pharmacy students who can be trained, and also pharmacy technicians who can be trained to administer vaccines. All pharmacy students in the US are trained to do this, and at least in my school, within the first maybe 2 months, when the new students start our pharmacy program, they're trained and certified to administer vaccines. So as students, they're allowed, under supervision by a pharmacist, to administer vaccinations. And many of our students have been involved with our COVID vaccination program. So again, this is, for those of you who are students, hopefully this is something that you'll be able to do in the future. This is just an example of the woman on the left with the face shield is one of our pharmacy students. She, when this photo was taken, was a second-year PharmD student. Now, this actually was not training. This was real. This was taken last fall. We were administering influenza vaccine to students and faculty of the university. So we had a mass vaccination program for influenza. We had many students who were administering vaccines. So I was supervising her as she was administering the vaccine. She has lots of experience and she did a great job at it. Okay, we don't have time to talk about the training programs. There are several training programs in the US. The one that most states use is the program developed by the American Pharmacy Association, or APHA. It's a pretty extensive program, and you can see on the slide what some of the components are of that training program. Again, it's pretty extensive, but it really provides the competency for pharmacists to be able to be out in the community, to work in vaccination clinics and do it effectively and safely. And these training programs do include actual practice in administering vaccine. Usually we use normal saline and not real vaccine for the training, but we have to certify that students or pharmacists can actually physically provide the injections, both intramuscular as well as subcutaneous injections. I do want to alert you to this webinar that's happening on June 29th. This is an FIP webinar. Again, if you're interested in vaccination, this is a webinar looking at multidisciplinary or interprofessional vaccination programs. Again, I don't have the link to this to put on the slide, but if you're interested, I'm sure you can go on the FIP website. But it looks like it'll be an interesting program. Okay, so that was a little bit of introduction to give you a little bit of information about some of the roles that pharmacists can play in vaccination. What I'd like to talk about now is a little bit of little bit of information about mass vaccination, and also share a little bit of my own experiences in mass vaccination programs over especially the last 6 months. As it says on this slide, mass vaccination is the most efficient way to vaccinate large numbers of people as quickly as possible. And you can see there's a reference that backs that up. But in reality, I mean, if we want to vaccinate 1.4 billion people in India, mass vaccination clinics aren't the only way it has to be done, because there's some settings where mass vaccination, large operations, really not appropriate. For instance, rural areas where there just aren't lots of people, a mass program doesn't really make sense. People who are institutionalized, whether it's in long-term care facilities, people who are in prisons, people who don't have transportation to go to a mass vaccination site, people who are suspicious or skeptical of the government or of healthcare systems. Those are people that aren't going to come to a mass vaccination setting. We have to go to them to provide the vaccine. Now, obviously, and now I have maybe 20 or 25 minutes left. I don't have time to talk about all of the details of this. So I can only discuss concepts, but of course, I'd be happy to discuss with any of you more details. There's many general guidelines on how to approach mass vaccination or how to develop mass vaccination. But any general guideline, whether it's a pharmacotherapeutic guideline or a vaccination guideline, has to be adapted to fit the current situation, because every situation is different. Of course, every country, every region within a country is different. So we take the general guidelines and then adapt them to whatever is happening in a local situation. Much of what I'll talk about for the rest of my presentation comes from this document, and this is from the American Society of Health System Pharmacists, and you can see that the title of the document is Essential Elements of a Successful Mass Vaccination Program, so very appropriate. And I think this quote here on the bottom is very important, that to have a successful vaccination program requires the skills and the expertise of the entire healthcare workforce. That certainly includes pharmacists, but it's not only pharmacists. So everybody in the healthcare system, everybody in the healthcare workforce has to be involved in the planning, the execution, and communication. We'll talk about that more in a moment. It is extremely important to have a successful mass immunization program. So what are some of the components that make up a successful mass vaccination program? Well, first is leadership. And any program, whether it's a pharmacy school and having leadership from the dean, or at the university level, leadership from the provost or chancellor, any program requires leadership. And in an emergency setting, an emergency preparedness or emergency operations, that leadership really has to be centralized, and it has to be very clear command and control. Now, if that sounds like the military, well, it actually is. And the way we manage emergency procedure like this is based on military type operations, because the military is most efficient at these types of operations. The system we use, and many of you may have heard of this, is the incident command system. And as you can see from the bullet points here, the incident command is simply a standardized approach to managing some incident, usually some type of emergency incident, but it could be a planned incident as well. And some of the key points about incident command is that it enables coordination. And of course, in any country, we have local agencies, we have local health agencies, we have regional, we have state, we have national. And if people don't work together, if they don't communicate and work together, it's very inefficient and things usually don't go very well. So incident command allows that coordination to make sure everybody's working together towards some common purpose. Resources can become very precious. Back early in the pandemic, at least in the US, personal protective equipment was in very short supply. So we have to make sure that resources are being used wisely and not being wasted. We do have a national incident management system in the US that we fall under for these procedures. Probably the most important thing on this slide is that pharmacists, or the profession of pharmacy, has to be part of the incident command team. And the incident command is a whole team of different people. If there's any involvement with medications or vaccines, pharmacists have to be part of that leadership team. One important point, and perhaps you already know this, public health people, Ministry of Health people have no idea what pharmacists know. They have no idea what pharmacists can do. So don't assume they know what skills and knowledge you have. You have to teach them, and you want to have that teaching done before there's some crisis. So make sure you're educating your public health agencies, make sure you're educating your Ministry of Health staff. So next is planning. Emergencies happen. Sometimes we don't expect them, but if we plan for emergencies, then we can react to them and do a much better job. So plans should be in place, and any of you who practice in hospitals, I'm sure your hospitals all have disaster plans in place. They have to be developed, they have to be practiced, so have exercises. And again, you want to have those in place before there's some catastrophic incident. The idea is we want to plan for anything that could happen. So-called all hazard planning, whether it's planning for pandemics, whether it's planning for bioterrorist or other terrorist attacks, natural disasters, earthquakes, typhoons, those sorts of things. I'm very fortunate that at the University of Arizona, not only me personally, but we as a university have been involved with emergency planning for quite some time. And as you can see, in 2003, we developed a bioterrorism response plan. This was shortly after the anthrax attacks here in the US with our county health department. 10 years ago, we actually developed our pandemic response plan, which we are now, until today, have been using for 6 months for our COVID vaccination program. So we developed that plan 10 years ago, and we actually implemented it for the COVID vaccination program. Again, the key is you want to practice these plans to find out what works, what needs to be changed. So this is in 2003, we practiced mass medication dispensing by pharmacists. This was after the anthrax attacks. So this was a drill. This is not real. We simulated an anthrax attack, and these are all pharmacists ready to dispense ciprofloxacin or doxycycline to people who had been exposed to anthrax. Yes, that's me when I was a little bit younger. Now, sometimes we get to practice in real life situations, and many of you may recall in 2005, we had a major cyclone or typhoon called Katrina in the southern part of the US, and many people died, many people lost their homes. And in Tucson, which is about 1,000 miles, maybe 1,500 kilometers from New Orleans where this happened, we actually had refugees come from New Orleans and we sheltered them in Tucson. We had 48 hours to develop this program, and we had 48 hours to set up a pharmacy. This is in our convention center in Tucson, and this is a snack bar that we turned into a pharmacy and dispensed medications to the refugees who came from New Orleans. Again, this operation lasted for 2 weeks, and then we shut it down. You can see we had several pharmacists, including pharmacists from the military, helping with this operation. So this was real, but it allowed us to practice what we had already learned previously to see if it would actually work in real life. Okay, so this is our mass COVID vaccination plan. Again, this was originally developed for pandemic influenza. I know this is difficult to see, but partly what I want you to see is the large scope of this plan. We actually had 2 simultaneous operations. The main one was a drive-through plan where people stayed in their cars and got vaccinated while they're in their cars. This is what you see here. We also had a walk-in operation where people could park their cars or just walk in from the bus station and get vaccinated. But what you see here is mostly the drive-through. And this is a little bit larger version, so you can see the traffic flow. So again, cars would come in on this street. This is right in the middle of the university. So this is the university campus. This is actually the basketball arena here, and the football arena is just behind it. So very, very large scale. So people came in, they got checked in, they got registered, and then proceeded to the vaccination area where they got screened by the vaccinator, got administered vaccine, then drove their car to the observation area, waited there 15 or 30 minutes, and then went on their way. If it was their first dose of vaccine while they were in the observation area, we made the appointment for them for their second dose of vaccine. The vaccine product we used for our operation was only the Pfizer vaccine, so which made things a little bit easier for us, only having one product. So this is what the public saw. So this is what was publicized in the media, so people would know where they would enter, what street, where the traffic flow would go. Again, here's the basketball arena here. Here's the indoor operation, and again, this is mostly drive-through. So communicating with the public is also very, very important, so they know what they need to do. So this is what it looked like in real life. So this is the same what you saw on the plan, except it's the opposite view. So this is the vaccination area, these tents. This is the basketball arena. These are people registering people in their cars. These are actually students registering people in their cars. And again, here you see the people entering the vaccination area. Luckily, this is mostly done in the wintertime, and luckily in Tucson, it's not very cold. We did have some cold days. Actually snowed one day, which is very unusual for Tucson, but we were tough, and we stayed outside for this entire operation. Someone, I don't know, I'm not entirely sure who put up this saying "farm to the arm." So from the pharmacy to patients' arms to administer vaccination. Each vaccination station had a team of 2 people. This is me, of course, as a vaccinator, and we also had a scribe who would be recording the information in our computer system. And actually, this is Tammy. She actually was a nursing student who was doing this, and she recently graduated, so she's now a nurse. This is the drive-through operation inside, and again, we did have an indoor walk-in operation, which you see here, and you can see each vaccination station had usual supply of vaccine, Band-Aids, alcohol swabs. Nothing very, very fancy. So many people were involved on a given day. With the drive-through operation, we had 100 people working per shift. Again, a team of 2. Here's me as a vaccinator. Here's a different scribe working together as a team, screening patients in their cars, deciding if it was okay to give them vaccine, administering the vaccine, and then providing some very, very brief patient counseling. Again, each vaccination station had very, very simple supplies. The pharmacy would provide us with an ongoing supply of filled syringes that we would use to administer the vaccine. So another important facet of this is communication, coordination, and collaboration. This is really, really important, and this is where leadership becomes important, to make sure that all of the different pieces are communicating together very, very well. And this is both important internally with the different parts of the operation, but also externally with government agencies, with the news media, with the public. One important point is that communication with the public is always controlled very, very tightly. And usually part of the incident command team, there's a communication officer, and he or she controls all communication to make sure that the messages are clear and that there's no confusion in how messages are being delivered to the public. There's at least daily meetings among all of the key people during the operation to make sure everybody's communicating. And of course, for us as pharmacists, communication with the vaccine production operation is crucial. We don't want to waste vaccine. We don't want to make more than we need. So we need to make sure there's good communication between the pharmacy manufacturing operation and the people who are doing scheduling, appointments, how many people are actually coming to get their vaccine, so that we can make sure we're not wasting any doses of these precious vaccines. So again, communication with the pharmacy operation is really, really crucial. Regulatory reporting and compliance, vaccine accountability, especially in the early days when vaccine was in very, very short supply, we kept very, very tight control of inventory. We still do, but at least in the US, the vaccine supply is much better now, so we're not quite as concerned about it. Since the COVID vaccines are controlled, at least in the US, by the government, both county, state, and federal government, we have to make sure that all the reporting is being done, and that includes if there's any doses wasted. To have a mass vaccination program, you need volunteers. You need lots of volunteers. We need to make sure that the volunteers actually are qualified to do what they're volunteering to do. So if they're administering vaccine, they need to have some training or some license that allows them to do that. Now, there are emergency declarations, at least in the US, that expand licensing capabilities, so people that in the past who weren't able to give vaccine now can. So the credentialing is very, very important. And again, since we need so many volunteers, using students is really, really important. And many of the people who are staffing our mass vaccination program were students, not just pharmacy students, medical students, nursing students, public health students. Many, many students were involved. Without the students, we really could not have done it. Supply chain, again, as I mentioned earlier, pharmaceutical supply chain, nobody does this better than pharmacists. So this is an extremely important role for us to make sure that the entire supply chain is being managed. Inventory control, make sure there's no loss or wastage, make sure storage is being done properly. Now I know in India, you're not really using the mRNA vaccines, which are kept frozen, but here in the US, we're using those extensively. So making sure we're thawing only what we have to use and then preparing only what we need. The storage and preparation requirements change pretty frequently as more research is done. So it's important that the pharmacists or the lead pharmacists are keeping track of how those things are changing. Any pharmacy personnel who are involved with vaccine preparation, we need to make sure they're trained and supervised. Now, and that includes not only pharmacists, but again, pharmacy technicians or maybe diploma pharmacists in India, pharmacy students, but we may also have nursing students, medical students, public health students involved with vaccine preparation as well. We need to have enough people to make sure it's being done properly. Labeling, of course, is very, very important to make sure things are being labeled properly. And used vials of vaccine, we want to make sure they're being disposed of properly. And the reason for this is because, at least in the US, and maybe this has happened in other countries, empty vials, used vials were being stolen, filled with saline, and then being sold on eBay and other online vendors, illegally, of course. So you want to make sure that those empty vials are being kept secure. This is our pharmacy operation. It was in a trailer right next to the vaccination stations. These are mostly pharmacists. He's actually one of our faculty members in the College of Pharmacy. He was the lead pharmacist supervising this. This is actually the governor of the state of Arizona who is touring our operation. And these are the freezers. Since we're using Pfizer vaccine, it has to be kept at -80 to -90. So we needed the special freezers. These were not kept in the pharmacy. This was in a different building. But again, the location of the vaccine preparation was physically in the same place as the vaccination administration, so there was no need for transportation. Now in the US, of course, we have three main vaccines, or three vaccines that are approved by the FDA. It's the Pfizer, Moderna, and Johnson & Johnson. I know those are not the vaccines you're using in India, but this table shows you some of the complexity of not only the different vaccines, but things like storage and stability and things like that are pretty variable. The efficacy of these vaccines, of course, studies are still ongoing, but there's certainly variability. I do want to spend a couple of moments talking about the vaccines available in India. I'm sure many of you have seen this website. Thankfully, it has an English version, so I could read most of it. But I believe this has pretty up-to-date information in India about your vaccination program. So especially for the students, if you haven't seen this, you may want to take a look at it. So as far as I know, you have several vaccines available in India. I'm not sure, honestly, which ones are used more than others, but I know one is Covishield, which is actually the AstraZeneca vaccine being manufactured in India. This is kind of a traditional adenovirus vector vaccine given in a 0.5 ml dose. In Europe, this is the second dose is usually given 4 to 6 weeks after the first dose, but I know that's been extended both in the UK as well as now in India to give the second dose 12 to 16 weeks after the first dose. The effectiveness of the AstraZeneca product, whether it's Covishield or other brand names, is pretty good. Again, 100% effective against severe disease, slightly less effective in other settings, but certainly a highly effective vaccine. One of the advantages, of course, of this vaccine and the others being used in India is that it doesn't require freezing, which is especially useful for rural areas. And so storage is certainly a little bit easier than the vaccines that have to be frozen. Covaxin is another vaccine I believe is available in India. This is very similar to the Chinese CoronaVac product, which is again sort of a traditional inactivated virus vaccine. This is given in a 0.5 ml dose. Again, the second dose being given 4 to 6 weeks after the first. Also seems to be pretty effective. High seroconversion rate with neutralizing antibodies, and the data available so far shows close to an 80% clinical effectiveness rate. Again, another good advantage, this only has to be refrigerated, doesn't need to be frozen, so very, very attractive, especially again for rural areas. And finally, I believe you also have the Russian vaccine in India, the Sputnik 5. This is also an adenovirus vaccine, so somewhat similar to the AstraZeneca product. Also given at a 0.5 ml dose, with the second dose given 21 days. Also only needs refrigeration, so very attractive from that standpoint. This is fairly recent data published in Lancet for this vaccine, and you can see that they're showing about close to a 92% overall efficacy rate for this vaccine, so seems to be pretty effective. And I'm sure there'll be other vaccine products emerging, if they haven't already, in your country. Vaccine safety, and there's a couple of things to think about from a safety standpoint. First of all, safety of the workers, so the pharmacists and other people preparing vaccine, to make sure they have enough space, to make sure it's safe. And we're using needles, there's risks involved here, so we want to make sure that we have safe space for people to work. Temperature control, of course, especially in very hot climates, we need to make sure that there's adequate air conditioning so that the vaccines will remain stable. And as I mentioned before, we want the vaccine preparation area to be very close to the vaccination administration site. As probably most of you know, after patients are administered the vaccine, whatever brand it is, they are observed for either 15 or 30 minutes. It's 30 minutes so that if they have any history of any severe allergic reaction to medications or to other vaccines. And this decision is made by the vaccinator. So we screen every patient, and me, in my case as the vaccinator, I make the decision about whether the patient's going to be observed for 15 or 30 minutes. We want to make sure we have emergency medications available. So we have epinephrine devices, diphenhydramine, corticosteroids close by. With a mass vaccination program, you need to have emergency medical personnel. So we have an ambulance on site. We have at least one physician on site. And luckily, with over 240,000 doses of vaccine administered, we had very, very few severe reactions. However, we did have some people who had vasovagal reactions and passed out after they got their vaccine. That's normal for people to have that reaction, so that's something you want to be prepared for. Most vaccines are only approved for adults. In the US, the Pfizer vaccine is approved for people 12 and up, so I've administered vaccine to lots of children now, 12 and up. The other vaccines are only 18 and above. Pregnant women, breastfeeding women can be vaccinated. Of course, it's their decision, but there seem to be no safety issues. I'm sure in India you have a national database for vaccine safety. In the US, we have a program called vSafe, which is basically a smartphone app that tracks any adverse effects that people have to the vaccine. Staffing, I've already mentioned this a couple of times. Of course, as pharmacists, we're focusing on the medical aspects, whether it's vaccine preparation or administration, but there's great need for non-medical people, traffic control, registration, security, line management, supply runners, the scribes who record all the information are crucial to the operation. So you need to make sure you have enough medical, but also non-medical. And of course, the number of patients you have in a mass vaccination operation maybe start small, expand, and then may shrink. So you need to be able to scale your operation up and down. That includes scaling up and down personnel. I already mentioned earlier recruitment and training of volunteers, and that's true not only for pharmacy, but for all volunteers. we suggest, and we found this out in our operation, that for vaccine preparation, having experienced hospital pharmacists is a good place to start, because they're most accustomed to managing vials and drawing things up and doing it very, very accurately. And then less experienced staff can certainly be trained. Again, use students. Students are going to be a crucial part of this. Administering vaccine, which was my role, it's actually really easy. I had the easiest job, honestly, even though, yeah, it does require some training. But giving an intramuscular injection is really pretty easy. The harder part of my job was making the medical decisions about, safety and observation. Take care of your staff. Volunteers get tired, they're not being paid. Make sure they get breaks, make sure they stay hydrated, make sure they get some food. Again, people get tired. Our mass vaccination operation actually closed today. I've been working there for 6 months, as most people had, and we were getting tired. And when volunteers get tired, they stop coming. So you want to make sure you take good care of your volunteers. So here's our vaccine operation, our University of Arizona operation, actually as of yesterday. Doesn't have today's numbers. Actually, as of today, we were in operation for 143 days. We administered, as of today, a little over 243,000 doses of vaccine. And you can see, here's the number of doses per day. And you can see that, scaling up and scaling down. The most we did was in April, early April, was about 4,500 doses per day. And you can see the number of people getting vaccine in the US has dramatically been reduced, which is why we closed the operation today. So again, all told, we gave over 243,000 doses of Pfizer vaccine. We closed our drive-through operation on June 1st because in Tucson it gets really hot. In June, the daytime temperature may be 43, 45 degrees Celsius, and it's just too hot to be outside. From a pharmacy standpoint, one thing we're very proud of is that out of the 243,000 doses of vaccine that were drawn up into syringes, we wasted absolutely no syringes of vaccine, so no wastage. So the pharmacists leading that operation did truly a fabulous job. So I know I've given you a lot of information, and I'm probably running a few minutes over time. Sorry about that. So a couple of concluding remarks. Again, I'm only focusing on mass vaccination. And again, there's a lot of different strategies that must be used. And certainly to be successful in India, you're going to have to use many different strategies. But mass vaccination, especially in large cities, it's not easy, but it can be a great way to administer large numbers of vaccine doses per day. Pharmacists have to be part of the leadership and operation of these programs. And again, public health agencies, ministries of health probably don't know what you as a pharmacist know. They don't know what you can do, so you really have to teach them and show them. Now, again, I've been doing this for 6 months, and it's been one of the most fun things I've done in my professional life. It's been extremely gratifying. The patients are extremely grateful. They're extremely happy to get vaccinated. Some of the kids aren't so happy, but for the most part, people are very, very grateful. And since I'm a professor in the university, part of the reason why I've been involved is because I feel that I should be a role model for my students and residents, so I can show them that, yes, I'm busy, but I can be involved. You're busy, you can be involved as well. So with that, I'm going to conclude, and I'll turn it back over to Dr. Uday and see if we have any time for questions.
Yeah, thank you, Michael. Yeah, the participants can unmute and ask 1 or 2 questions if you have any questions regarding the vaccination. Professor Michael, I have one question regarding what are the challenges you have faced during the vaccination drive?
I mean, logistically, there are many challenges, especially as we started getting more and more people. And honestly, one of the biggest challenges was traffic, which was not my role. But at the peak of our operation, we had 350 cars per hour coming through our operation, and we wanted to make sure that it was safe. There are many people in the vaccination station, many cars coming through. So safety was a big challenge. Again, that wasn't my role, but we were all very, very worried about that. Doing the operation outdoors, weather was a challenge. In Tucson in the wintertime, some mornings it was below 0 Celsius and my hands get cold and it's hard to administer vaccine when your hands are cold. I guess the other challenge I had is, I'm still doing my regular job. I'm still a professor at the university. I'm still teaching, and balancing my volunteer effort with my regular job and my family, and that certainly is challenging. But my feeling was that this is a public health crisis, and I wanted to be part of the solution. I wanted to help get past this pandemic. I didn't count how many doses of vaccine I gave, but I think it was about 5,000 doses that I gave myself. I feel pretty good about that, that I helped prevent COVID in thousands of people.
That's really good.
Any other questions?
We have one question. How do we explain to the people that no side effects after the vaccination does not mean vaccination is not working?
Mm-hmm. Yeah, actually, that's a great question. What I tell people is that the side effects tell you it's working. So having some side effects is actually a good thing. Now, scientifically, that may not be true, but anyway, that's what I tell patients. Because basically what I tell the patient is that if you're developing a fever or pain at the injection site or fatigue, that's a sign your immune system is responding to the vaccine, and that's a good thing. So basically I tell the patient, if you have 24 hours of feeling bad, that's a good sign. And number two, it's much better than getting COVID. And part of my practice is in the hospital. I've seen many patients die from COVID-19. It's not a good way to die. So I don't tell patients that, but if you balance some side effects from the vaccine versus developing COVID-19, it's pretty simple. Now many American patients are still very skeptical, and I talk to them and try to give them objective scientific information. Ultimately, the patients have to decide for themselves. The problem, of course, with social media, there's all kinds of misinformation on Facebook and other social media. And, sometimes patients, and I'm sure this is true in India as well, patients believe what's on social media and don't believe what we tell them. So, all we can do is give them the most objective, factual information, and then ultimately patients are going to make their own decisions.
So we have one more question. This is regarding what is the criteria for taking vaccination for COVID-19 positive patients?
For COVID-19 positive patients?
Yes.
The CDC guidelines say that you should wait 90 days after infection to get vaccinated. Now, that's especially important if the patients receive the monoclonal antibody treatment, which actually was just removed from the market in the US today because it's not working against the variants. But the monoclonal antibody will actually prevent the vaccine from working. So actually one of our screening questions is, number one, have you had COVID infection in the past? And if they say yes, we ask them when. And then we ask them, did you receive the antibody treatment? And if they receive the antibody treatment within 90 days, we actually don't vaccinate them and have them come back.
Yeah, Professor Michael, we are very thankful for taking out your time in spite of your busy day of work, then answering all the questions and a very elaborate presentation and a practical tag. Thank you for spending the time with us. Thank you very much.
You're very welcome. And my first slide has my email address. So if anybody has any questions and you want to email me, I'd be happy to hear from you. So please don't hesitate if you have questions that come up. And so if you want to distribute my slides to the participants, it's perfectly fine with me.
Sure. So now I request Dr. Jinu J. Joel, Head Department of Pharmacy Practice, to propose the vote of thanks. Jinu sir, over to you.
Hello?
Yes.
Yeah. Hello, a very good morning to you all.
Good
I
morning.
deem it as a great honor and privilege to propose the word of thanks. First and foremost, I thank our Honorable Vice Chancellor, Professor Dr. Satish Kumar Bandari, Nitte Dept University, for accepting our request and found time to take part in this webinar. Secondly, I thank the speaker for the webinar, Dr. Michael D. Katz, Professor, College of Pharmacy, University of Arizona, United States of America, for being here with us today and sharing us his views on role of pharmacists in vaccination program. I express my sincere thanks to our principal, Dr. C.S. Shastri. I also thank Dr. Uday Venkat Matteti, who is the coordinator of this webinar, for planning and organizing. My heartfelt thanks to all the participants who gathered here in this online platform. Finally, I thank my team for their cooperation in making this function a resounding success. Thank you very much.
Thank you, sir. A big thank you to all the participants for your commitment in attending this webinar. Thank you very much.
Thank you, everybody. It's a pleasure meeting you.